Okay, so hi everyone. Thank you so much for joining our seminar today. And to show respect to the presenter, please make sure that you mute yourself throughout the presentation. And if you have any questions during the presentation, please pop them in the chat box and we'll attend to them during the Q&A session at the end. Please note that this seminar will be recorded and uploaded on our YouTube channel. So if you have any issues with this, please do let me know. And it's our pleasure to have Dr. Stephen Vincent as a host for the seminar today on the topic of coal dust. So Dr. Vincent is a respiratory and sleep physician in Cairns, working in both the public and private sector with extensive experience in occupational lung diseases, including but not limited to mesothelioma, asbestosis, silicosis, occupational asthma. And over to you, Dr. Vincent.
All right. Oh, thanks for spending your lunchtime to listen to the talk. So I thought I'd do this particular talk because the media, doesn't really give us a lot of information about what's going on in regards to mining, coal mining. Are we doing more of it? Are we doing less of it? And what are the health problems? So I thought I'd give you guys a rundown on what the current evidence is and what the problem for the future. So I'll just start my slide. And can you hear okay still?
Yep, I can hear you.
Good. Okay, yeah. So I guess the main thing is that what I want to talk about is the negative health effects on coal dust. And believe it or not, it's not just limited to people who work within coal mines or the coal industry. It's pretty much anywhere that the coal is taken from the mine itself, travels along the road, taken to the shipping area or processed at foundries or power stations. So anyone who's sort of in that way can be affected by coal dust. And I'll talk about what coal dust is, the background, and what sort of conditions can cause impairment. So I'm just trying to get the...
I think you can just click the mouse. Would that work?
Yeah, oh, here we go. Yeah. All right, so I'll go through, I know it sounds like a silly question, but what coal actually is, how it's utilised in 2024, the way that it's extracted, it's whether open cut underground mining, what sort of particles are not dangerous and dangerous, and the effects on the lung and on disease states in general, and what's considered safe levels. So, we all know that coal is a non-renewable energy source. So it's essentially millions of years of deposit of mainly plant material. I know a lot of people say it's dinosaurs, but that's probably only contributes to probably 0.5% of it. It's mainly ancient forests, ancient grasslands that deposits on lakes, and then over time it gets compacted, hardened, can chemically become altered, and then eventually through heat and pressure over time it changes to coal. And because it's got a lot of carbon locked in there, it's a good energy source for utilisation. And it goes through a different process depending on pretty much the pressure and heat. So the low quality coal, which is known as brown coal, is something called lignite. And then there's something called subbituminous, and then bituminous. And then the most, probably the highly prized after black coal is anthracite. So all four of those are mined in Australia in 2024 and continue to be so. Now, the main way of using coal, we all think that it's for generating electricity. Probably about 80% to 70% of coal is used for in manufacturing electricity through simple process of heating water, which produces steam and turns the turbine. So at the moment, the vast majority of coal that's burnt in Australia is used for electricity generation. but it's also used in the steel industry. So a lot of steel to become hardened usually has about 1 to 3% of coal within it. So coal trucks, deposit coal at foundries and so forth. It's used in cement production, making of carbon fibre, and some of the synthetic petrol-based fuels as well. And people used to use it in their home and as commercial heaters, but not so much anymore. So the use is not just for electricity generation; it's also in industry as well. And as far as who uses it throughout the world, you can see in the pie chart there that the vast majority of coal, probably about 2/3 or so, is utilised in China and India. And we're sort of ranked down the bottom 9 there, about 1.7% of the consumption of the coal in the world. So that's not a huge amount, and we only contribute to about 3% of greenhouse gases. So we still use a lot of coal per capita, but per surface area of the country relative to the surface area of land, it's not a huge amount. And the consumption of coal is actually going up and not going down, mainly due to increased power stations being built in India and China. And also there's more and more industry in these areas as well that use coal as well. So despite hearing a lot about zero net pollutants and carbon and all the rest of it, we're actually using more coal per year, and that's continuing to rise at the moment. Now, as far as where coal is mined in Australia, there's a number of coal mines around Australia. The electrical generators of coal power fire stations. We've got 4 over in Western Australia. There's 6 or 7 up in Queensland, 4 power stations, coal power stations in New South Wales, and 3 down in Victoria. So we still have quite a number of coal powered stations around, and if we turn them all off, say tomorrow, then pretty much the whole electricity grid will collapse, because we need to have a base load of electricity through a 24-hour cycle, including the night. That's where solar power falls down. And also a lot of industry uses a lot of electricity that the current renewables such as air and solar just unable to sustain. So I think the sort of holy grail of completely renewable energy sources to be able to maintain a base load, which I think at the moment is going to be some sort of battery in localised areas, unless you go nuclear, which I don't think there's any plans for that at the moment. So I think we're still reliant on coal-powered stations for many years to come. Now, as far as the amount of coal mines in Australia, I mean, when I was looking into this, I didn't realise there's quite a large number. There's about 127 coal mines around Australia, and 80% of those are open cut mines. I'll talk about open cut mines in a sec, but then everyone sort of thinks that they're much more healthier than underground minings, but these still do liberate a lot of coal dust and can be harmful to people working in the coal industry and people living nearby. Now, we've got about 1,200 years of coal in reserve, so it's not going to run out anytime soon. And it's one of our major exporters, $112 billion worth of coal in the financial year 2022. So it's one of those things that we can't really afford to sort of turn off our coal exports in a hurry as well, because it's one of our major things that contributes to our annual GDP. And the top 4 buyers around the world are Japan, South Korea, Taiwan, and India. We do sell to China, but not as much as we used to. I think some of the other countries sell brown coal to China. Now, as far as open cut mining, as the name says, they essentially just get a bit of ground where there's superficial coal just under the surface, and then blast away, and then just keep digging down until the seam runs out. So what they do is they remove the surface soil, and then you've probably seen on various videos that there's blasting that goes on where you can get great mountains just disappear with the explosions. And then these trucks, you can see the size, the scale of this thing. You can see with the laser pointer there that's actually quite a large truck. That's probably a 5 metre high truck there. So you can see the extent, the size of these coal mines. This is the Collinsville one in Queensland. And a lot of them are actually automated in Western Australia. So a lot of the trucks that go down, grab the coal and drive up they don't have any operators in them. They're run by remote controls. I mean, that obviously takes some of the danger out from workers, but there's still a lot of people working in the coal mine there. And the thing is, you're not restricted by the size of the opening. You can make it as big as you like. This is compared to underground mining and faster production, and it costs less. So you can actually get per ratio of the grades of coal, you can get lower grade or at cheaper cost. So open cut mining has advantages that you can just do it wherever you find coal. You can use trucks as large as you need, and it's cheaper to run than an underground mine. But the reason that there is underground mining, underground mining is that sometimes there's coal deposits which are very far underground. They can be up to about 4 or 5 kilometres down under the surface, and it's not cost effective to blast 5 kilometres worth of land to get down to these coal seams. So this is where the underground mining comes into it. Now, that you'd think that the picture on the top there would be, something from the 1980s, but that's actually a recent picture there. So you can see the amount of dust that's liberated. That's just standard dust that floats around in the air. And even though it's a large airway, unfortunately it's still in a relatively confined space, that anyone down there is exposed to the dust. And you can see the guy on the bottom there, he's just covered in the stuff as well, and it's just everywhere. Okay, now as far as what's dangerous, so you might have heard of a measurement called PM 2.5. So what that means is any particulate matter that's less than 2.5 micrometers in diameter can get down to the sort of the lower levels of your lung, where the air's taken in and the carbon dioxide's breathed out. And any material that's this small is actually taken up by the scavenger cells down there called the macrophages. So the things that you might have heard in, say, pollution warnings, especially in Victoria and New South Wales, is what levels of PM10 and PM2.5 are. So they're important because they can actually interfere with your health. Anything larger than PM10, which is 10 micrometers, is usually sort of cleared up in the large airway in the nose, and then you either blow it out or swallow it. So, and for example, I had a look at Melbourne's pollution level this morning. Their PM 2.5 level was 30, and it's considered safe if it's less than 10. So, people are driving around breathing in a lot of particulate matter on the freeways at the moment. And I won't go into talks about living near freeways, but they're adverse to health as well. So as far as who's going to develop any adverse effects, it's people who work for long hours and for years in the coal mining industry. So usually if someone works 38-hour weeks, for 30 to 40 years, they've got about a 20 to 30% chance of developing some sort of underlying lung disease, especially if appropriate dust suppression and respirators are not used. So they both open cut mining and underground liberate a large quantity of these 2.5s. And not only does it spread within the confined area of the coal mine, it also includes the surrounding towns as well. So it's not uncommon for people who live near coal mines, say their partners or kids, to develop chronic lung disease from breathing in the coal dust that's sort of blown over the town. And these people are also at risk for people who work at coal-fired power stations, because once again, as the coals move from the trucks into the reservoir of coal, it's disturbed, and there's a lot of coal dust that's moved around. And I think you might remember a couple of years ago down in Victoria, there was one of the power stations caught fire, and for about 6 months, this fire kept burning, and essentially anyone who had a respiratory disorder had to move away because the amount of PM 2.5s were about 1,000 levels above what's considered a safe level. So it's not particularly good for your health, especially if you've got an underlying respiratory problem, to work in a coal mine or even live nearby one or a coal-powered station. So it's still a dangerous thing for your health long term. Probably, you know, for about a third of workers who've worked there for more than 20 years or so. Now, what happens with these particles? So these are the airborne particles. So the ones that you can actually see are ones that are more than 70 micrometers in diameter. So if you split a human hair and look at it edge on, that's about 70 micrometers in diameter. So you can imagine that what we're breathing in that's causing harm, you can't actually see. So you can't actually see the dust that's causing the problems. So I've got a little diagram here that's got sort of an example of relative size of PM10 down to 2.5 micrometers in diameter and down to PM0.1. And these are the particles like sulfur dioxide, nitrogen oxide, and that sort of thing that can get directly into the bloodstream. Now, what we have as far as our scavenger cells in the airways is we've got things called macrophages. They just gobble up any particles that enter the lung. When that occurs, especially with the coal dust, they sense that there's some sort of danger going on and call in these things called neutrophils to try and destroy the particles. And that's where you get chronic inflammatory changes, things like emphysema, where you get destruction of the little air sacs at the end of the lung. People can also develop a condition called chronic bronchitis, where you've got normal airway there, which is like a thin tube, and then this becomes thickened and secretes a lot of mucus over time. So one of the other chronic health effects of breathing in coal dust is, you know, a chronic productive cough, recurrent chest infections and breathlessness. And then the other thing is just a thing called black lung or coal workers pneumoconiosis, where you get these fibrous nodules throughout your lung, which shrinks down and causes a lot of scar tissue in your lung. And unfortunately, it can be so bad that people require long-term oxygen and in some cases lung transplantation from silicosis from coal mines. Okay, so the negative effects are, you know, mainly due to these biological effects once the coal dust enters the airway and the bloodstream. So as I said before, you can get coal workers pneumoconiosis, where you get progressive shrinking of the lung due to scar tissue, you know, requiring oxygen, emphysema, and this is even in non-smokers, where it's destruction of lung tissue due to the inflammatory effect that these coal dust particles have. And we also, now recently, you know, we think silicosis is confined to people who work with artificial stone and those bench tops, but there's a lot of silica in both the open cut and underground mining as well. So not only are people inhaling coal dust, they're also inhaling small crystals of silica that in people who are predisposed to developing silicosis can develop the classic silicosis, and that's from working under the mines. As I said before, chronic bronchitis is a condition, and progressive scarring of the lungs called pulmonary fibrosis. And there's a non-specific disorder called respiratory failure called mixed dust pneumoconiosis, where people just have a non-specific reduction in their functional capacity of their lung with a history of exposure to coal dust. So they're pretty much the 6 different respiratory effects that you can get from breathing in coal dust without any appropriate respirator and so forth, which I'll go into a bit later in the talk. Okay, now here's just an example of the chest X-ray changes that you can get with long-term inhalation of coal dust. The chest X-ray on the left is normal, so you can see that the lung fields, the lung field on the left is actually the right lung, which is larger than the lung on the left. The main reason being is that grey blob in the middle is your heart. On the middle chest X-ray, this is called coal workers pneumoconiosis or black lung. You can see that there's these large conglomerates of grey tissue, which is a whole lot of scar tissue that causes the lungs to shrink, and then respiratory failure. And this is silicosis on the right-hand side, where you've just got all these tiny dots everywhere on both lungs. And you can tell that you definitely would have a lot of respiratory symptoms such as shortness of breath if most of your lung is taken up by silica nodules. Okay, so the people at risk of developing any coal dust lung disease are those that are exposed to coal dust without any respiratory protection over time. So the thought is if you work 38 hours for more than 20 years, that you will develop some form of underlying coal dust disease. Whether or not it's symptomatic depends on a number of factors. One is makeup of your genes. Some people can cope with having this disorder and not get breathless. And it can occur from anyone who lives along the pathway from the coal mine to the ship. And this includes along the roads, because a lot of coal dust is liberated on the train tracks and also the roads as well. And these people are not really captured in any sort of screening program that's available. Smokers double their chance of developing underlying coal dust disease. And any place that's got high levels of PM 2.5, which unfortunately is probably most coal mines, because it's really hard to bring the levels down to 1.5 milligrams per cubic metre of air. So most of the open cut mines are about 2.5 milligrams per metre cube of air breathes around. And that's using probably the best suppression techniques that they can use today. Now, as far as what we look for with people that we suspect may have an underlying coal dust disease, first of all, you've got screening. So people who work in the coal industry have annual lung function testing and a chest X-ray. So the first sign that you're developing any coal workers lung disease is that your lung function starts to decline, or you start to develop nodules on chest X-ray. So they automatically get taken off the roster and need to see a respiratory physician to see whether their abnormal lung function or abnormal chest X-ray is due to the coal mine or just due to some other process such as smoking or asthma. Now, the trouble with screening is it's usually screening of the current people who work in the mining industry. It doesn't take into account people who have worked for many years, and doesn't take into account people that have worked who live nearby in the towns or along the roads or in the shipping yards where coal is exported. The other one's case finding, which is just people presenting to their doctor with a respiratory symptom, and they say have a chest X-ray or lung function test and it's abnormal, and the doctor goes through an occupational history and finds out that they worked in a coal mine for 15, 20 years, and then gets referred on to work cover to say that they've got an underlying coal workers lung disease. And of course, you manage other lung conditions. You obviously, if someone has any coal workers lung disease, you manage other conditions like asthma and smoking. And the unfortunate thing about development of these conditions is there's no actual treatment for it, for both silicosis or the coal workers pneumoconiosis. And once the disease has established itself, despite being removed from the source, which is the coal mine, the disease becomes progressive, and miners can develop significant respiratory symptoms, shortens their lifespan and their functional decline. So it's all fairly depressing stuff because there's no management at the moment. Now, as far as prevention, what most, mainly with the above miners, they wear what's called a personal sampling equipment. So each day they have this sampling pump that draws in air around their mouth, really just to see what their work environment has in regards to PM 2.5 and PM 10. Now, as far as people who work in the open cut mines, this could be anywhere from the office managers, secretaries, in the demountables, truck drivers, electricians, diesel fitters. So there's a whole lot of people that work in the open cut mining apart from just the miners. So these sort of things are utilised by everyone. Now, as far as respiratory protective equipment, unfortunately, in the underground mining, this needs to be a positive pressure device that's worn around your face that sort of blows away all the coal dust. And it's very hot down there and humid. It's about 80% humidity and usually runs about a temperature of 28 degrees. So a lot of people underground won't wear their respiratory protection equipment throughout the whole of the shift because it's just uncomfortable to work on. And also, if you're in an above mine, then depends on the type of work, depends on the type of protection that's used. And everyone goes through a process of fit testing to make sure that it fits properly. And also everyone has to cut their beards because there's no way that you can protect yourself from coal dust if you have a beard, despite the best intentions as far as the protective equipment. So I guess, yeah, so sort of a summary is that in 2024, coal is still an important fossil fuel, mainly for the economy and also for generation of electricity at the moment. Haven't really heard any grand plans from the politicians of what they're going to do once the coal stations are shut down, because we're relying a lot on solar power and wind, but we still don't have the solution for the base load. So I think the coal powered stations are here to stay for a while. And not only is these PM 2.5 particles significant health consequences in miners themselves, it could be anyone who works at the coal mine, including administrative staff and other tradies, people who live nearby, and anyone on the travel distance from where the coal mine takes it to its end place, which is either the to ship it out overseas or to the coal stations. And obviously prevention is better than cure, so there's got to be strong dust regulation and appropriate respiratory protection equipment to minimise any harm. And as far as screening goes, unfortunately, local towns are not screened. So I think the poor old GPs in the town are the ones that do the screening for this and look out for chronic lung disease that may occur in people who would otherwise not have a lung disease, such as non-smokers and non-asthmatics. And the trouble is there's lack of data of who's at risk, how many people are at risk, because there's no registry of current miners and there's no registry of previous miners as well. And there's called a long latency as well between the exposure, which means that there could be up to 20, 15, 30 years from exposure to the coal dust to when they develop their symptoms and disease. So I guess it's an area that needs a lot more study, especially longitudinal studies, to see, how many people employed are at risk. We don't know whether it is only 5% or 20%, what the impact of vaping and smoking has on exposure to coal dust. I mean, these are sort of questions that are unanswered. And unfortunately, once you've got established disease, then there's no real treatment. And it's a sort of a miserable way to go when people have chronic cough with mucus production, short of breath doing minimal tasks, and in some cases require lung transplant if they're less than 60 or require long-term oxygen. So I suppose that's sort of a snapshot of coal dust. It's pretty depressing stuff, but I guess it's an important thing that's here to stay at the moment. So that's why strong regulation needs to come in and screening of the at-risk population. So happy to take any questions if anyone's got any.
Yeah, thank you so much, Dr. Vincent. That was very informative. Now, if anyone has any question, please unmute yourself and just come forward, please.
And happy to answer
Hello,
questions by
hello,
email.
can you hear me?
Yes.
Sorry, I've been dipping in and out, but I've been quite engaged in all that you've been speaking about. Just with patterns of disease that you are seeing in your practice,
Yeah.
are autoimmune diseases something which are featuring, or because from my experience in dust diseases work, dealing with clients all around the country and people who've been injured in the mine sites,
Yeah.
we see a lot of lung disease, but we're also beginning to see autoimmune conditions
Yes.
in the coal mining industry, but also in other silica silica-based sectors. Scleroderma, rheumatoid lupus. I'm dealing with a matter at the moment, a fascinating claim involving mixed connective tissue disease, where there's a bit of a battle as to whether there's a causal connection or not. Of course, we say there is,
Yeah.
and so on and so forth. But I'm just wondering whether you are seeing these other diseases,
Yeah.
and how you go about, I guess, spotting them. Because for a long time I was finding we were seeing clients with these autoimmune compromise, but no one was really letting it be known to them or going to the lengths of looking at their condition in the context of their occupation. And it's just wondering whether it's something you come across and how you go about dealing with a patient in this sort of situation.
Yeah, no, it's a good question because it's been known sort of in small case series in the literature that rheumatoid arthritis was associated with black lung even in the 80s and the 70s in the UK. It's something they call Kaplan syndrome. But yeah, I think they were sort of largely ignored up until fairly recently with the benchtop silicosis, where there is a lot of, so I'm probably of the same view. If you've had exposure and you develop a connective tissue disease, which is slightly out of keeping to the normal one, so being male is abnormal for connective tissue disease. It's usually 3-to-1 ratio of females to males develop connective tissue disease. Usually their disease is systemic, like with scleroderma, it's more systemic. So I think if there's a good history of exposure, and that you don't necessarily have to have chest X-ray changes to get the connective tissue disease, I err on the side of the exposure resulted in the connective tissue disease, especially when it's a male. So yeah, I'm seeing horrible scleroderma, horrible lupus, people on immunosuppressions that develop bad chest infections, and I know it sort of gets fought tail and
we've had some tough battles,
yeah,
and we're beginning to make some inroads, but it hasn't been an easy ride. And just very quickly, one final question: lung transplantation, is that something that often emerges with regards to occupationally exposed patients that you see in the context of the exposure through the coal mines and elsewhere?
Usually it's in the silica. So it's unfortunately people become too old for a lung transplant, because once you hit the age of 65, your chance of developing a bad opportunistic infection from the immunosuppressant medication is high. So people over 65 don't do well with lung transplants. And the other thing is there's a lot of scarring and pleural disease that actually makes the actual operation of transplantation quite difficult. I think in Victoria, I think there was 2 or 3 people who went for assessment of transplant in the silica setting, but they deemed they were inoperable because of the anatomical distortion due to the underlying lung disease, where they just couldn't get a lung transplant because they wouldn't have been able to take out the affected lung and put a new one in. So it's probably a small end of things. As far as the silicosis, what Brisbane offer is something called whole lung lavage, where if anyone recent, it was Dan Chambers. It's essentially what they do is they pour water. So you're under general anaesthetic. pour saline into your lungs, and then it comes out the other end. And I was talking to Dan James, who does it. He's noticed, yeah, it's quite amazing that you put in clear water, and the first 3 or 4 litres that comes out looks like milk, which is all the tiny amounts of silica that's in there.
Yeah, it's pretty amazing. World first type of treatment, which Dan has been involved in for years. I've got a few patients at the moment, those working in the stonemason industry, who have had that level of treatment. And I think I'm not sure whether they have been able to see any benefit and whether it's a work in progress at the moment.
Yeah, I think it's a work in progress, because the only silica they can remove is the stuff that's in the alveoli.
In the upper lobes.
Yeah, because once it's actually entered the tissue of the lung, then it's unfortunately stuck there, and it causes chronic problems there.
Okay. Well, thank you for your responses, and I might liaise with you under separate cover about some of the things that we're seeing in our practice, which is quite fascinating. And as we're learning something new all the time.
Yeah, no, happy to help.
It's interesting stuff. But yeah, appreciate your replies. Thank you.
No worries.
Yep, thank you so much for that. And does anyone else have any questions? You could unmute yourself. If not, yep. Can you see the chat, Dr. Vincent?
Yep. Oh, thanks, Amber, for your response. Yeah. So I think, this is definitely an emerging area. It's not something that's decreasing in time. It's actually increasing in time with better screening and case finding. So I think it's probably going to keep us busy for many years to come.
Yep. All good. So thank you so much, Dr. Vincent, for your talk today. And yeah, I think
I think I've got a few more talks in the next month or 2 as well.
that's right. Yeah. So Dr. Vincent will have 2 more talks coming up. So just stay tuned, and that will be on our Eventbrite page. I'll stop the recording now.